although Krista, who I'm about to introduce, and who is our Director of Enrollment and Outreach, felt that going through the training, she already knew a lot of the stuff. That's not the feedback that I've necessarily gotten from the other staff people who've gone through it, who said, I didn't know quite as much. And I'm saying that because Krista does not like to be introduced as an expert, but she really is, and she's working really hard, deep in the weeds. I joke with her that I'm like a big picture person. I'll get down to the details if I need to, but she's very happy in the weeds. So in this next presentation, Krista is going to take us there. And if you've been holding off on your detailed questions, Krista's the person to ask them to. So I know you already asked me about spend down, and somebody else asked me about long-term care, and that falls into the issue of like current populations versus future populations. I know Krista will talk about that. Yes?
Actually, I have a question about the CACs. How does MMAC fit into this whole picture, the Michigan Medicare Medicaid System program? As far as CACs? Are they going to be CACs?
I don't know if Cabinet Social Services has made a decision yet.
Okay. All right.
I still think they're kind of a question mark.
Okay.
I certainly hope so. The more the merrier. And if you're a quasi-CAC, like St. Joe, you are a CAC. You get to play on the whole playground. So if you're doing the work, you're doing the work. So, but I don't know, I haven't heard back from Cabinet Social Services. So, hopefully.
No, so it's good. So Krista's gonna talk about a lot of stuff, but I did wanna, before she comes up here, just make note of two things that are in here that people have asked me about. One is, I did take a sheet from healthcare.gov about dental coverage for adults. You know, it's mandated for kids. For adults, it's not mandated, but it will be in some of the programs, in some of the plans that are offered. In other plans, it will be offered as a rider. So if dental coverage is really important to the person you're working with, we can look for a plan where it's included. And at the back, Krista also has the specific training for certified application counselors, which if you are contemplating it, she will take your hand and guide you through it. And what you will want on hand for this is this. Everything you wanted to know about the ACA and Medicaid, you will surely want that while Krista's talking. Krista Nordberg.
Thank you, Ruth. Let's go. How many days? Not too many. So on Tuesday, I was talking to the great people at Delanus. I had a conference call with President Barack Obama, and it was like a pep talk. It was actually really awesome, and I think it went out, nationwide. I don't think it was just me, but he reminded us that we are going to be part of history. Like this, we will look back on this someday and be like, this was when America really provided health care for all its citizens. It will be, hopefully, a monumental thing. And then I thought about Michigan, and I, laughing with these guys, we have 1 million uninsured people in the state of Michigan that are going to be eligible for either tax credits or Medicaid under expansion. So this is an awesome opportunity, and everyone in this room is part of it. So let's go. It's going to be like Plan A on steroids. I wanted to start, I guess, briefly reading off my scribble notes from the email that I read on Ruth's little smartphone, because I don't have a smartphone. Just some of the things that MDCH has kind of stated, and I kind of went over a few things already, but the bottom line is April Fool's Day is the earliest start date. That's kind of funny. There's 2 waivers that still need to go to the feds for approval. The first waiver they're saying is gonna be going early November, which they're expecting approval by January 1. They say they've been in constant contact with CMS on this waiver, so they're expecting an approval. So waiver 1 goes through, we start Medicaid expansion. Waiver 2 going a yea or nay vote is not gonna hold anything up, because waiver 2, they're gonna need 2 years to prepare and collect data, whatever that means. And this one is the 49-month limit, but it's not really a time limit, it's a movement from Medicaid expansion to the exchange, I think, for the 100 to 138% population, and increased cross sharing. But that one's like on the back burner, and it's not gonna hold anything up. So we can just forget about waiver 2 for right now. And but looks like waiver 1's gonna go forward, and waiver 1 is, it's gonna be cost sharing, and it's still not clear how this is gonna work. It's gonna be health savings accounts, and they're not sure that they want this administered through the, is it 13 Medicaid health plans? I'm not sure, but, so anyway, it's whether or not they're gonna kind of divert this to 2 designated vendors. But again, this is something that they don't even really have to roll out for 6 months after they start Medicaid expansion. So it looks like Medicaid, the bottom line is, from reading this, is it looks really good that Medicaid expansion is really gonna go forward. Hurrah, hooray. What else on here? And then sort of like what the ultimate benefits are gonna be on Medicaid expansion, that's still a little unclear. They said in this memo or recap that they're very mindful that the Medicaid expansion folks are gonna have substance abuse needs, they're gonna have mental health needs, they're taking this into consideration. Hurrah, hooray. And that's about it. And then they also said, and this warms my heart, that they really expect the ABW, the Plan A folks, to just seamlessly and effortlessly move to Medicaid. So I'll believe it when I see it. But so that's good news. It was all pretty positive news as far as MCH, and then clarifying that the marketplace is not going to be reviewing Medicaid eligibility under expansion. So that's going to be for us to kind of do and know. So what I've been trying to do is just come up with like a list of common questions and then throwing in answers and just keeping a running total. And so I just kind of came up with this. And this is just, it will be a document probably under revision and under expansion. And as we learn more, like I still have a whole bunches of big gray areas. And a lot of the gray areas are just because until I actually do something, I don't really know what it looks like. Like I can't say, this is what you need, this is what you're gonna, how you get it there, this is where you get your exemption, this is how it functions. I don't know any of that. So, like we have all your email addresses, that's awesome, if you don't mind. Like I said, as this becomes, I'm better able to clarify, I absolutely will, and I will get this information out to folks. So, just starts really that, healthcare is kind of going to become the law, and you have to have it. And they were, people who have Medicare and Medicaid now or insurance through your employer, you're fine. You're in compliance with the law. It's everybody who's uninsured. And people who have like dental only plans, that's not going to cut it under the law. If you're a woman with just plan first, that's not going to cut it under the law. It really has to be more of a comprehensive plan. And that's going to be better defined as to what like actual coverage has to be in an employer plan. They put that up in 2015. So something we'll talk about at our next conference meeting, you know, everything we still don't know about the ACA. So, so I think people have gone through, I'm just gonna kind of go through this. Next time I do this, I'm gonna have slides up of like Brad Pitt and you know, Penelope Cruz, and I'll just click them through and we can have fun. But one of the big changes under both the marketplace and Medicaid expansion is the definition of a household. And this is gonna be really important. This is your tax filing unit. This is you, if you're the tax filer, and all your dependents. If you're married, you have to file a joint return in the year that you want to claim tax credits. You don't have to file, you know, a joint return with your spouse if you don't want to, but you won't benefit from tax credits. And, you know, they were asking about previous years. If you haven't filed in previous years, it's not relevant to 2014. As long as you are, you know, applying in 2014, getting tax credits, and file your taxes in 2014, make sure you're in compliance with the law up till then. And the nice thing about this group is we can be sure, like, once, you know, we have insurance or information on who in the area will help people file taxes through the VITA program, we can also share that, because I think that's really an awesome program and underutilized, and a lot of people are actually eligible for money back that they're not aware of. So something we can kind of like push in conjunction with this, because they're in some ways going to go hand in hand. One of the areas that I'm still going to clarify and I will get information out about is, you know, and this is my situation, so I'm divorced, right? My husband and I split our tax exemptions with the kids. It's like a property division. So there is language in both the Medicaid expansion and in the standard operating procedure manual for the, if anybody's gone through the CAC training, about that this is one area of sort of where it's potentially you can sort of say that's actually not the tax filing unit, because, you know, the 3 kids that my ex-husband claims as a dependent, they actually live with me. And so if you have a custody order that in fact shows that, then the household can change. But again, I haven't really included anything in here yet, because I don't know how you get that information where it needs to go. I don't really know how, it's not clear to me yet. But this is just an area that I will get clarification on, and I absolutely will share. Because I think I'm not the only one. I don't think I'm the only divorced person.
A tax filing unit might exclude the 22, 24, 25, 26-year-old. You can include your health insurance plan, but you might not be filing your own taxes.
Right, and then they would have a choice, right? They would have a choice. But I think the way I'm reading the rules now, if you're over 20, if you're 21 or over, and you're claimed as a dependent on your parents' taxes, you're not a separate tax filing unit. You are with your parents. You are still with your parents. So you don't.
But you can be not on your parents'
And if you're
taxes,
not,
you'll be eligible to be covered on your health insurance.
right, if you're not covered, then you're your own tax filing unit, right? Whether or not you file taxes or not, no one else is. And so you're free to go to the exchange. You're free to be eligible under Medicaid expansion. Like you're your own standalone household.
Even though you have coverage. My daughter has coverage, but I don't claim her own taxes. She files.
And then I guess if she has comprehensive coverage,
Right.
then the question is, it's not employer offered. That's a very good question.
Yeah.
That was your question. She files her own taxes, but she's on the St. Joseph plan.
I think she's free to make a choice. I think she's free to go to the health insurance exchange and make her own decision, right? I can get a better deal here than there. I'm taking the better deal. Yeah, so parents.
I can compare all.
I'm sorry? It is not about residents.
Claiming as a dependent or not, regardless of where the individual.
Right, it is not about, so Medicaid rules as they exist now, many of us who do a lot of Medicaid stuff know that it's more a legal responsibility. So if in my household it's me, my new husband, he's got a kid from a prior marriage, I've got a kid from a prior marriage. For Medicaid, my household for Medicaid is me, my husband, my kid. For him, it's him, his spouse, and his kid. Now, going forward, if we all file taxes together, we're a unit of 4. We're a household of 4. If you're a step-parent with stepchildren going forward, and they're in your household, and you claim them taxes, you have 1 unit, they're in your household, their income is counted. So it's gonna cut both ways, I think, as far as they say overall, it'll probably be more people eligible, and we'll see. So, yes.
What about the unmarried couple that have a kid together living in the same house?
How do they file taxes?
They file separately, but then
Who claims the child?
usually the mom, but now on Medicaid, they're considered.
Nope, it's still tax filing.
Okay.
It's tax filing.
Okay.
So the Medicaid expansion rules are gonna follow the marketplace rules.
So just big taxes, that's what you're telling clients, just big taxes.
For Medicaid expansion,
Okay.
yep. Tax filing
Outside
unit,
taxes,
that's how it's gonna be. Yep, yep.
Okay, I've heard a couple of different conversations, so I want to make sure I'm wrapping my brain around this. If you have a child that is over 21, filing their own income taxes, but they're on your health insurance, they have the option to go and shop the marketplace to see if they can get a better deal.
Yep,
Okay. And get out of their parents' pocketbook for health insurance.
yep.
Got it.
I think I'm right. If I'm wrong, I will let you know. What's that? Right, if you claim them as a dependent, then they're not free to go on their own, right? That's right. It's all included. Exactly. Mhm. Yeah. Oh. Okay, so I'm sorry. Okay, so the question was, how old? Doesn't matter. 21-year-old kid. I'm on my parents' insurance because I can be.
But they're filing their income taxes separate.
Right, but I'm not claimed as a dependent on my mom's income taxes because I'm taking care of my own business in every other way, right?
Right.
So is that person free to go to the marketplace? Yes, I can't think of a reason why they wouldn't be. So, and then they would be able to get the tax credit exemptions and anything else? Yeah.
One caveat to this too, we cleared this with the state insurance commission, is that the person using the marketplace is who gets the tax credit. So we've had questions about, if I pay for my 21-year-old daughter's insurance, do I get the tax credit? No, your daughter gets the tax credit. That's how it's approved.
Right, unless you claim her as a dependent.
No, if your daughter uses the marketplace, whoever uses the marketplace is the direct person who receives the tax credit. If someone else pays for the coverage, it's still whoever uses the marketplace receives the tax credit. Yes. Says it's all who files the taxes. It's really weird. We were just talking with them on Monday about this because it seems like it's kind of like, well, if I paid, shouldn't I did it?
You don't. Okay. So what I think I should do is dig a little deeper and really firm this up because, you know, this is one of those areas where the more questions you ask, the less sure you are of the answer not giving. So we're done at 3:30, so it's been great. No, so seriously though, I'm gonna look in, I think this is a great point of clarification.
And that's the only reason I was asking this, I think it was great for them to extend the age for parents to provide health insurance for their children. But I'm thinking if you have children that are working, but they're only working 20 hours or, they're working less hours or they're not eligible to receive their company's health insurance or it costs too much. This is an option for them to shop the marketplace to get health insurance where the parents maybe don't have to pay for those children that are over the age of 21, something along those lines. That's why I was asking.
Right, it's a choice for them. They're adults, it's a choice. It's a choice, Okay, any more questions about the household? Yeah.
So when you say household income,
Okay.
you're referring to the tax files.
So that's where I'm going next, income. So household, new. So income is also going under a radical new definition for Medicaid expansion. And you can back that up because it's the same definition that's going to be used in the marketplace. So the new thing is MAGI. So it's your modified adjusted gross income. So let's see, I'm on, where am I? Okay, so it's kind of on the top part of the second page. So your modified gross income is your adjusted gross income, whatever that number is on your 1040, plus any foreign earned income or tax exempt interest. I'm assuming that's all on tax forms. Things that have been counted in the past for Medicaid, for eligibility, are things that are not going to be counted going forward for MAGI. And the big one is child support. You don't see it for any eligibility purposes. VA benefits, workers' comp benefits, and adoption subsidies. So those are things that are not part of the adjusted gross income, ergo, they are not part of your income going forward for MAGI eligibility. So,
SNAP.
I'm sorry?
What about SNAP?
SNAP that's still going to be under the old rules. So the only thing that MAGI is being applied to is Medicaid eligibility. So all the other programs, food assistance, as far as I know, that's all staying the same. Greg, is that true? So for eligibility for like the food benefit program, child care. Oh, no, public benefits are never counted as income, food benefits. But MAGI is not going to be used for food benefits, just Medicaid, correct?
Food benefits will still have the
Asset testing, but the income will be the same rules as before, right? So in the world of Medicaid, on some level, simplified, but on other levels, now we have two ways of looking at what counts as your household income. One MAGI, one the old rules. So,
Krista?
yeah.
You say deduct alimony. You can't deduct child support if somebody has to pay child support. Deduct that, it's just alimony.
So, right, if you pay alimony, it comes out of your adjusted gross. It's not in your
Is
adjusted
alimony
gross
and child
income.
support the same thing?
No, child support goes to kids,
Right, so you
alimony
deduct
goes
child support.
to your ex. So don't count, so when you're coming up with your adjusted gross income dollar figure, something that will not be in there is child support. That comes off. If you're a mother receiving child support, right, it's not in there. If you're a mother paying alimony, it's not in there either, so take it off. One would be in addition to your income, I'm getting child support, the one would be taking away, I'm paying alimony. So you can deduct it if you're paying it. If you're receiving it, it's income.
If you're a parent, you have to pay child support. You deduct the child support from your income.
Another good question?
If it's based upon the taxes, no. I know that.
So it's in your,
We can't well, okay, now some things won't be, but when my husband pays child support, it's not, we can't claim that on taxes, so if it's based on taxes, then I
It
would
is.
say no.
right, so it's in your adjusted gross income.
It's not deducted from my adjustment.
Right,
My-
it's in there,
Right.
is a
Yes.
dollar.
Yes.
But the woman that you're paying it to,
She doesn't have to count.
she doesn't, it's not counted in her adjusted gross income.
No.
And so if you were paying alimony,
Yeah.
that would not be in your adjusted gross income.
Right.
But for the person receiving alimony, it would be in their adjusted gross income. Does that make perfect sense?
So money for herself, or like we'll say, for him or herself, they have to count, but if it's for his or her child, they don't have to count it.
Right.
If you're paying into a tax shelter, 401k, or similar retirement plan, that would be,
That, I don't know. So,
Because that's a pre-tax.
pre-tax, so if it wouldn't be in your adjusted gross income, then it wouldn't be in your number, whatever that,
Yeah, it's.
number 12 or 17.
they go by the same rules as income based and what qualifies. They're very.
Okay. Isn't this fun? All right. So now that we have tax filing unit down, we understand magi with a whole lot of gray areas. I'll briefly, let's go back to this real quick. So on page 1, and this is more for the CAC people who are going to be doing marketplace stuff, but stuff you're going to need, that you can tell people, that you'll be seeing people, like what do I need to enroll in the marketplace? Name, social security number for every person in your household, policy numbers for all your current health care coverage, and if someone has an employer offered insurance they haven't taken, in your packet is sort of an employer coverage tool that's put out by healthcare.gov. And I've actually started giving it to folks who have healthcare available through their work, but they've chosen not to take it, because this information on here will be needed for the marketplace to determine if it's over or under the 9.5%, to determine whether or not you're eligible for the tax credits. So you can start getting this out to folks, because employers gotta start seeing this too, so they're get comfortable doing it. And the first one will probably be hard and a little confusing, but after that, hopefully the employer will know he needs to get this information available to folks and then have it.
So you don't think that a child who qualifies under their parents, that wouldn't apply to them because it's not their employer, it's the parent's employer that the child is under? That
Right.
would be-
This
that's
is
not
your
their
employer.
employer.
Right.
So even though they qualify under, their parents' insurance, they don't consider that to be
Right.
their employer.
So if it's me and my spouse, and neither of us have insurance, but she's got it available through her work, but I'm the tax filer, so maybe I'm the one doing the marketplace, I'm still gonna need her employer information to put into the application. At least that's what they tell us. So,
So a lot of, I mean, most workplaces have a variety of insurances available for their employees. You can sign up for the HMO or the PPO. You know, so how do, what number do you plug in on in terms of, on those kinds of sheets? You know, I mean, the cost to you, through your employer, for your insurance, is usually, there's a lot, it's a moving target, there's a lot of numbers.
so what they're asking for on here is the lowest cost plan that meets minimal value standard, which is covers 60% of the total cost. So it would be like the bronze one. At least benefits under the bronze one. So the plan covers 60% of your deductibles, 60% of the co-pays, or 60% of the co-pays and co-insurance and the premium. If it doesn't even meet that, then technically this is a two-step evaluation to get the tax credit. It must be more than 9% of your income, 9.5%, or doesn't meet minimal value standards. So if all your employer offers you is a catastrophic plan, it's not meeting the requirements, you would be eligible to get premium tax credits on the exchange. It would not meet the minimum value standard. Is that clear too? I know, there's so much. All right. So then turning to page 1, backside, let me see how I have all this stuff on here. And I'll just go through this pretty quickly because a lot of it you've already heard. So the different qualified health plans, we're good with that. The premium tax credit. The big thing to note for between the Medicaid expansion and the premium tax credit is the one designation that is going to keep some folks in one area and out of the other is your immigration status. So if you're lawfully present here, visa, green card, whatever your immigration status, you are fine to go on the exchange and get your premium tax credits. Even if your income is low, and you're an immigrant, if you have not had your green card for 5 years, your permanent resident card, you are not eligible for Medicaid until you hit that 5-year mark for immigration. So that's going to be a huge difference between the marketplace and Medicaid. And then the employer offered insurance, the cost sharing reductions, next page, modified adjusted gross income, no asset test, penalty we've talked about, exemptions. So the exemptions are pretty interesting because there's a whole big area of other hardships. So, and again, I don't know what the form looks like on the exchange. I don't know what kind of a process people are going to have to go through to get their exemption designation from the marketplace that they can then use on their tax return in 2014. Like, this is all kind of out a ways. We're talking about something that will happen more than a year from now, right? But folks are going to need it. And the other exemption list is extensive. I mean, it's incredibly extensive. So domestic violence victim, recent eviction, unexpected expense of caring for an ill or disabled family member. And I mean, that is not, the list goes on and on. Basically, I almost got the sense of, if you can help someone craft a good reason why they maybe didn't get it, I don't know if it'll get granted or not. Again, we haven't had anybody test this, but it did seem extremely broad as opposed to being narrow. It seemed very broad, and these were exemptions through the marketplace. And then there's also exemptions that you're gonna get through the IRS. So it's weird, like one place you're gonna get one exemption, another foretold to get the other one. And so if you've had no insurance coverage for less than 3 months, that's the exemption you have to get from the IRS. And again, I haven't really seen much direction for that, except that that's where you go. So again, these are things that we'll definitely need to fill in the blanks on, but just kind of know going forward that these exemptions exist. And then, the effective dates, kind of covered that. This is something just identified, verified online. This is gonna be much clearer when we actually start doing this work on the marketplace, for those of us who are gonna be doing the enrollment. But this is stuff I got out of the standard operating procedure manual, which is what, 140 pages long? That was fun to read. But this was on there, so, you know, you're gonna put all your information in there, and then the marketplace is gonna hopefully just verify you are who you are. Great, hi Krista, welcome, we're so glad you're here, we verified everything, you are who you say you are. So, in the case where somebody's identity cannot be verified, and I don't know why that would happen, but clearly it will, because they're already explaining what you will need if they cannot. So they'll need one of the, and they talk a lot about how you can scan and upload and send documents, so I'm kind of getting the feeling like this is how they're gonna want communication, through scanning and attaching, which is great, it's very easy. Except, I mean, I guess if you're at your house trying to do this, or at the library, but whatever. For those of us who have this capability, things that will be accepted are an ID card, school ID, voter registration card, or passport, or two of the following: birth certificate, social security card, divorce decree, employee ID, high school or college diploma, property, title, or deed. And that was kind of a period, like in the manual. So this is an area that may come up more, like us CACs or quasi-CACs or anybody helping folks. This is something that we may need to work together on. I don't know yet. Like, we may find that they do a 98% job matching people's identity to their application, and this isn't even, like, they're batting 100, you know? But I don't know. But I just thought I'd put it in there. And then you can appeal a decision. So if the marketplace gets it wrong, and you don't think they got your income right, you don't think they fairly evaluated how much you should get in premium tax credits, there's an appeal process. Again, I don't know what that looks like yet, because I haven't seen it, but like, as we know more, as we do this in reality, these things will come up, but certainly you don't have to accept their determination as the end of the discussion. So, changes that you have to report, of course, change in income, a change in your tax filing unit, marriage, gaining dependence, losing dependence, relocation. And then they talk very briefly in the manual about the renewal process, and if you file online, you will get your renewal online unless you indicate otherwise. And really there wasn't a whole lot of detail there. Again, we'll know more in the fall next year. But they did seem to indicate if like there were no changes, my income's about the same, I like my health plan I picked, that you'll be able to just very easily just sort of like say, I'm happy, click, and you go on. I don't know if that'll be true, but it sounds good. So I don't know what the renewal process will look like yet. So marketplace, so moving on quickly, and I'll just try to go really quick, I'm sorry, I know it's been a long day, but just Medicare and the Affordable Care Act, there'll be some preventative benefits that will be covered with no cost sharing, and it will reduce the cost sharing for prescription drugs, so I guess shortening the donut hole, making it smaller, that's good. Just wanted to make sure people were aware of some, I think, underused programs for Medicare beneficiaries who would also be eligible for Medicaid. So if your income is less than about 100% of poverty, you can get full Medicaid. I'm not talking about expansion now, I'm just talking about Medicaid rules as they exist now and will be in effect in 2014 until we are told otherwise. But they can get full Medicaid. So Medicaid will pick up the 20%. and they still get their drug benefit through Part D. And then there's another, I think, underutilized Part D assistance program, where if you're low income, it's like $17,000 for one person, then it basically eliminates the donut hole in its entirety. You don't have one anymore. So these are things that exist now. And then there's the SLIMBY program, they call it, for people with incomes between 100 and 120% of poverty, and they'll pay their Part B premium. And trust me, these are poor people on disability or retirement who are getting about $1,200 a month, and having that extra $100 in your Social Security check every month makes a huge difference. So these are programs we can access now. So then just, you know, of course, the information on Medicaid expansion is pretty slim at this point, because we don't know much. What we do know is the current Medicaid programs that exist now are gonna exist in 2014, like nothing is going away, so we're in no way getting less. So kids who have household incomes up to 200% of poverty will still either get Healthy Kids Medicaid or My Child, CHIP program. That's awesome. Those are the big things, you know. You can read the rest of it, you know, we all know how, somebody asked if the spend down program is gonna go away. So it's not, but in many ways, you're gonna be way, way better off going into Medicaid expansion than having a spend down. So I'm thinking of parents. So most lower income parents, although they don't qualify for the low income family Medicaid, because the income limit is practically nothing, they still get a spend down, but for anybody who knows how spend down works, it's nearly impossible to use. And those people will all go to the expansion. That's the new group, woohoo, that will get, not automatically, they'll have to apply for it, but this will be, I would be surprised if there was any cross connection between Medicaid spend down and Medicaid expansion. Because you can have a household limit very high, you know, over 200% of poverty, still get a spend down. Now your spend down is probably going to be $1,500 a month, right? But you're not going to be eligible for Medicaid expansion. Like you're going to be over 138% of poverty. So you would still be, you could still get the medical deductible, but at this point you're way better off going on the exchange. Well, you would have to go on the exchange at this point. So,
Krista?
yeah.
I was asking about long-term health care. Long-term care.
Long-term care,
Yes.
as far as I know, that will not be eligible. You won't be eligible to get that under Medicaid expansion. So, but some of the exclusions to Medicaid expansion are not 100% clear to me. And the only thing I have seen are the proposed MDCH rules, so I'm a little bit reluctant to say this is the gospel yet, because it hasn't been codified as the gospel. So, but the things they're throwing out as not eligible under Medicaid expansion is long-term care, the Medicare beneficiary program, but you already have Medicare, so that precludes you from Medicaid expansion. There is 19 to 64, so you can't be 65 or older in Medicaid expansion. So sometimes the exclusion, if you think about it, you get why it's excluded. Oh yeah, it was never included to be excluded, so it just kind of confuses.
So for the regular Medicaid, for those who are 65 and older or have SSDI or SSI, or that's still going to remain the same. Those qualifications that are on this sheet.
That's right.
As of right now, that's still going to be.
That's right.
The same. And I just want to make sure, I'm pretty sure I know the answer to this, that somebody can't say, who's over 65, I'm choosing to go to the marketplace versus having Medicare, and can they do that, or do you have to?
No.
You have to take Medicare once you're 65.
Yep.
That's still going to be, okay.
Yep.
Medicare. Medicare, not Medicare.
Right, you can't.
I
But,
figured, I just want to make sure.
right, but Medicare comes to you practically free. So,
Well, I mean, because I work in a senior building, and, you know, a lot of people have that, you know, they pay 104, you know, some people are just now receiving 115, and then they have to pay the supplemental. But they're still just over,
that
you know,
Slim
over
Bee.
the Slim Bee.
Yeah.
But, you know, I mean, like my parents pay close to $800 a month just on their Medicare, Medicare Part D, and their supplemental. And that's $400 individually. That's a lot of money, you know?
Right, so if you yourself are eligible for Medicare or Medicaid or affordable employer, or, you know, TRICARE or affordable employer insurance, you can't go to the marketplace, right? Yeah, you're precluded. It's not, this is,
I figured working with the population, I knew that might be a question that we get, like,
Right.
I might be able to,
well, can
I
I
might
give
be
you
able
a
to get
deal?
cheaper, whether, you know, to not get my Medicare or my supplement.
Right,
So, but that's not an option.
right.
Yeah, but there's Medicare Advantage plans that are.
Well, yeah, but they don't cover anything. They cover very, very little. I would not recommend the Medicare Advantage for most of the population I serve. Really, yeah. I found that out when somebody went to get a flu shot and they got $100 bill for
Are they
it.
going out of network?
Huh?
Are they going out of their network?
Nope.
So I have a question about someone covered with SSI.
So SSI, still, if you get SSI in Michigan, it's an automatic connect to the Medicaid program.
Yes, but that's also included in the expanded Medicaid then, or that group of individuals is gonna be included with expanded Medicaid?
No, but they don't need to be. So, I mean, on one hand, you could think of it, and this gets technical, but maybe not. There's really two worlds in Michigan. There's two kind of big clumps of Medicaid eligibility. One we call SSI related categories. So that's for like the disabled folks, SSI, SSDI. And then the other clump of folks is called TANF. And that's benefits for what are needy families. What's the T stand for? Temporary assistance for needy families. So it's the TANF clump that is the Medicaid expansion people. And so the SSI related clump is staying the same. But you can choose. So one of the big questions is, I'm somebody, I've been found disabled, I get $1,000 a month from RSDI, I'm gonna get my Medicare in 24 months, thank you very much. What do I do in the meantime? I'm over income for Medicaid based on a disability. Where do I go? This is where, what I'm being told is, you have the choice to go to Medicaid expansion until such time as your Medicare kicks in. So this is a huge potential benefit for those folks between 100 and 138% of poverty who are getting Social Security disability benefits, who in the past really had to wait until their Medicare kicked in to get any kind of insurance. So that's a good thing. So my understanding is you can pick which pot you want to be in. And it really will only be relevant that I can see for the people who are getting Social Security disability above Medicaid, SSI-related Medicaid, which is about 100% of poverty, but still under expansion. Yep.
And if they're over the same person, their social security check comes from over 138, they're going on the healthcare
Exactly.
with
Yep.
subsidy.
Right. Where they get their tax credit subsidy and the cost sharing reduction, silver plan.
Until Medicare.
Right. Until Medicare kicks in. And then they get Medicare. So that's about it for Medicaid expansion, because we just don't know much. I mean, And there's no asset test for Medicaid expansion, so that's sweet, because the asset limits for Medicaid are super incredibly low. So a lot of folks have been kept out just because they have $5 grand in the bank, and in every other way, they might qualify for a Medicaid program, but for the little bitty money they have in the bank. So that's completely going away, which makes me hope that the Medicaid application process for the expansion population is gonna be fairly easy. Like, you won't need things like car titles, bank accounts, like a whole lot of the verifications that we have to try to track down and get to folks, we won't need anymore. And so for any of you who do enrollment on Maximus for kids or pregnant women, that's like the easiest thing since sliced bread. And so if it looks and leans more towards that, I am the happiest lady. That's what I'm really hoping for, and that will look a lot more like that than the current system for Medicaid enrollment. And I think it will have to, because they just won't need much, right? It's gonna be very straightforward.
Krista, this isn't really a question, but I just can't believe that older adult advocacy groups have accepted this, because it seems like everyone is going to be eligible for affordable health care except older adults. And that seems like mass discrimination to me.
You mean people who are receiving Medicare?
Who have to pay big dollars for supplementals.
We're paying more than 9% of her income.
Right.
Ladies and gentlemen, she's paying way more than 9%, but she's not eligible for the health care.
And they're only paying for parts of policies. They're not even paying for a whole policy.
Didn't I hear
But-
that the poll is closing on those plans, and that they have to have the minimum requirements and coverage?
Okay, so one of the things they're getting is preventative care, but remember, Medicare beneficiaries, as long as they meet the asset test, and I have the information in here, also may be eligible for full Medicaid.
But they seem to be the only group that needs to meet the asset test. And why would that be? And then it seems like their premiums are exorbitant for supplemental compared to.
And you think of the state of Michigan, I mean, we know, I don't know what it is yet, but that Blue Cross Blue Shield, which is, I think, pretty good plan, is going to go up.
Right.
What is it now, I think, $124 a month or something like that? The tax, and it's supposed to go up within the next couple of years for Medicare supplemental.
To like 107. But if your premium, let's just, for ease sake, let's just say your premium is $100 a month, right? And you're getting $1,000 a month, you're eligible for full Medicaid. It'll cover it'll cover that 20% annual premium.
But
So in
what
some
if you're
ways,
getting $1,500 a month and you have to pay $400 a month?
but then you're opting into that Part C, right? Is that what we're
That's
talking
correct,
about?
yeah.
So you've got Part A, free.
Right.
We're just talking about citizens here, we're not even going anywhere else. So, Part A, free, Part B, 107, 104, something along those lines. That's your full range of benefits. I mean, that's your
But you need
80%,
supplemental.
right? So at 80%,
Ah,
you're
I see what you're saying.
you're a goal plan person, right? Already. You're a goal plan person, and if it's 9.5% of your income is unaffordable, if you're getting $950 a month, you are eligible for full Medicaid. Now there are asset limits, but the asset limits for the Quimby Slimby program are higher, and they're in here. I put them in here. Not a lot higher than Medicaid, but they are higher.
So what you're saying though is, I think what you're saying is monthly premiums are gonna be a lot more, but really in the overall, what you might have to pay if you have hospitalization is gonna be less. Because if you have, say, a market plan, you still have to pay 20% of your co-pays, but if you have a Medicare and a supplement that takes up that 20%, you're gonna be better off in the end.
And if you're low income, your supplement comes from
Yeah,
Medicaid.
but it's not, I'm struggling mostly with middle income people.
Right.
So the $1,500 a month.
Yeah.
So you're not getting any of the benefits.
Right.
Right.
Right, so you're still at a silver plan, right? Like, I mean, until we see the rates on the marketplace, it would, you know, somebody can test that. I mean, that may be something that becomes, and that may be why they kind of threw in for Medicare, closing the donut hole, or shrinking it, threw in free preventive kind of care stuff.
So if you don't have a supplemental, you get the preventative, you don't have to meet that $125 for that, what's it first?
B,
Part B is $125 and
that's your office visits, right?
Right, okay. So
Yep.
you wouldn't have to pay for that, you would just get your preventative if you didn't have a.
So that's funny, I asked that question because, you know, people can opt out of Part B. Ugh. You shouldn't do it, but I did ask that question, if someone opts out of Part B, do they still get the preventative care? And the person I asked did not know. He said, good question,
That's the physician-
no answer,
That's
so.
the physician's charges, is Part B, so preventative care is physician.
Part A is only hospitalization.
It's hospitalization.
So no, they opt out of Part B, they don't get lab work, they don't get preventative care, they don't even get doctor visits.
Okay,
But I'm asking, if you have Part B, will you still have to pay a deductible after 2014? You don't have to.
for preventative
For
care.
preventative care.
For preventative care,
Right,
yep.
so if you didn't have a supplemental, you wouldn't even have to pay that, because we know that if you have a supplemental to your Medicare, generally it will pick up that Part B deductible, annual deductible as well. But if you don't have a supplemental, you still won't have to pay that Part B deductible of $125 or whatever it is. Okay.
Yeah.
It's a little bit.
I just have a real quick question.
Sure.
So if one is on Medicaid and they get Medicaid, the traditional Medicaid status, their assets go over $2,000, can they then move into the expansion?
Once it opens?
Yeah.
Absolutely.
So,
Yes.
so that would be a win-win situation for somebody that could then start having some savings, and that's always been a dilemma for us with a lot of folks, is that they can't get anywhere because they can't get anywhere.
If you're
Right,
under
like-
age 65.
Right,
65, you still have to asset test
for,
for Medicaid, for Medicaid over
Yeah.
65, so.
Right.
you can't if you,
Yes.
so under 65, yes, over 65, no.
that's right. So, did I cause more confusion? Because that's what I've done to myself. The more I try to learn this, no, seriously, I'm not kidding. The more I try to learn this, the less I feel like I know.
But the more you question.
Right, so, but the more answers I get at the end of the day. So, this is totally a work in progress. 1 million people, folks. 1 million Michigan residents that we can help get health care.
So before you go, I just want to say a couple things. Thank you to all of our presenters. First of all, we didn't include evaluation forms, but if you have good, bad, ugly comments, I'd love to hear them. We are, the CareNet program is planning, based on feedback that we got from the forums and surveys that we've done, we're planning to do some orientations for new case managers over the next year. But sitting here, I'm thinking that maybe we will offer a second ACA orientation as we get closer to the Medicaid expansion, when we actually have some information. How many people think that would be useful? Okay. Thank you for coming.